Right.
Hello, you're watching Transforming Media. I'm here with Kimber, and oh, well, that's what your friends call you. What's your professional name, your real name?
It's Kimberlain O'Driscoll.
And last Friday, we were at the first ever Bronx Transgender Health Conference here in New York City, where I was the keynote speaker, and she came, and she was very impressive during the Q&A section. And the Bronx Transgender Health Conference was a time for service providers, activists, and people who were born with a transsexual medical condition, people who have transgenderism, or people who are intersex, where everyone came together to talk about important issues for healthcare access, medical treatment, and so many other issues. And hopefully this conference is just going to get bigger and bigger and bigger. And it was very, the conversations actually throughout the day started to get very, heated, complicated, and it was just amazing. So when you say heated, what do you mean by that?
There were a lot of people with opposing views, and neither side really wanted to give in to what the other side was trying to say, and both sides were trying to be heard at the same time, which happened when you were speaking, and that's when I thought I had to step in.
First of all, I just wanted to say that this was such an inspiring conference, and I'm so thankful that Community Health Network and the Bronx Community Pride Center, co-convened this conference along with, other different supporters and sponsors also supported it, but it was just so needed. Because a lot of times people with transsexualism, people who are transgender, people who are intersex, really have to go through so many hurdles and obstacles just to get the human rights, just to get health care. There's a lot of fraud going on in the insurance companies where they're trying to deny people with transsexualism their health care. There's just, so talk more about when you came up to the Q&A section. What happened is after I gave my keynote speech, they had some panelists come and talk about healthcare access, and then they had a Q&A after, and she came and she tell us about the vote that you did that I thought was very interesting.
Well, first of all, what you mentioned was that people with the transsexual medical condition, we've got medical needs that those that are in the traditional gay, lesbian political movement weren't really addressing. So there's a little bit of confusion, resistance to what you were trying to say, so I think I come down and clarify. So what I did was I asked everyone there who's transsexual to raise their hand if they opposed what you were saying, that the transsexual medical condition needed to be addressed as a separate entity. And only one person opposed you. And when I asked for those in support, hands went up. I estimate maybe a dozen, so 12 in favor, 1 against.
Which I thought was very symbolic, because when you have a transsexual medical condition, it means that you have different medical needs and legal needs than, let's say, if you are a genderqueer activist, where you basically don't identify with gender, or if you just do it for entertainment. Like RuPaul, he's a great comedian. I think he's very funny, but he is a man. He is a drag queen. He's not transsexual. Or a cross-dresser or transvestite. So basically, people with a transsexual medical condition are tossed into this box called the T-box. Some people are calling it the transgender Borg because it encompasses 10 different subgroups. However, if you're transsexual or intersex, you have medical needs that are specific, and so our medical needs have been put to the back burner in favor of a gay and lesbian political agenda, in favor of a genderqueer, let's dismantle the gender binary agenda, and those are valid agendas, but we would prefer if people would recognize that inside our doctor's office, we don't want these politics. You know what I mean? We want our medical legitimacy to remain intact, and unfortunately, it's being jeopardized when people misrepresent. And and it was, and someone, and you know, people were upset that you took a vote, you know.
Sometimes you have to shake it up a little bit, but you know, I mean, I've been in healthcare for almost 30 years now. I'm a nurse, and I've worked in clinics that had transgender and transsexual patients, and many times we would have a woman of transsexual experience come in, and she needed to have a prostate exam done, or a man of transsexual experience who needed a GYN exam done, or a pap smear, or a mammogram. And these are things that is a very awkward and confusing thing for many doctors to perform, and these are things that we need to address. We've got hormones that we have to work with. Some people, surgery is the route that they have to go through, and this is far more important than, in my opinion, something like marriage rights. Marriage rights are important to some groups of people, but health care, that's about lives.
Right, and you've been a nurse for over 30 years, and you actually, and I'm not sure if they know, but you do have a transsexual medical condition as well.
Yes.
And so when you have a medical condition, and you have, a lot of times what happens in society is when people don't understand things, you know, they fear it, and then from that fear, sometimes they start hating it and denying it human rights. And what's going on with people with transsexualism is people don't understand it, and I think it's easier for them to put it into a box, into a reservation, and say, well, you're the same thing as gay and lesbian people. Right. But in reality, this is not about sexual orientation. This is about, you know, being born with a birth challenge. You know, some people look at it as a disability, some people look at it as a birth defect, but it is a birth challenge. You are born with a medical condition. And it's extremely problematic when we have, I'm not trying to offend anyone, but I feel that there are some lazy and intellectually dishonest entities out there that are misrepresenting us completely. For example, there's this big research study right now called Injustice at Every Turn by the Task Force and by the National Center for Transgender Equality. Most people with transsexualism will tell you that this research is actually an injustice at every turn to people who are born with transsexualism because the data is actually inaccurate. They say so-and-so percentage of people who are transgender have gender affirmation surgery, or whatever word they use for that surgery. Well, but it was such a low number. Why was it a low number? Because of course cross-dressers and genderqueer people or cisgender gay and lesbian people are not going to need hormones and gender affirmation surgery. So they're basically appropriating and co-opting us for their numbers, when in reality, and so what they're doing is they're delegitimizing our medical condition. They're making it seem like it's cosmetic, it's elective. No, this is not a choice. And so it's just so overwhelming when so many people are, and I was just, you know how I was just on the phone with that girl right now from DC. So I was on the phone right now with an old friend who is also a nurse, and those are the cats you hear in the background.
I have two.
Harlequin and
Carly.
And they're the cutest cats. She was basically, we were basically just saying about how it's a lot of time doctors don't understand like the differences about what's going on. Right. But what I was getting at is that she said in Europe and in South America they use the word transsexualism, especially in Europe. And that's because in Europe they're more sympathetic to the medical needs of transsexualism. Here, the gay and lesbian movement, which is very powerful, has basically co-opted us into this gender non-conforming, genderqueer, transgender box, and they don't have the medical needs we need. They don't need the legal needs, or we need to change our birth certificates, change our driver's license. So it is imperative, if people say that they're health care providers, that they take care of our health. Because by saying that a woman who has transsexualism is the same thing as a gender deconstructionist or a drag queen, basically you are misgendering them. By saying that a woman who has transsexualism is the same thing as a crossdresser or a transvestite, you are objectifying them. Some would even say it's sexual assault. It is extremely, it's very, very, it's just amazingly unbelievable that people are getting away with rewriting the narrative of transsexualism, just completely turning a medical condition with over 100 years of data, research, and caring, understanding professionals. In a matter of 15 years, we went from having a medical condition that it was represented as a medical condition, but now in America it's considered as a colony of the gay and lesbian community. Now it's considered gender expression, it's a choice. Oh, it's now become a social political agenda. I'm sorry, our medical condition should not be used as someone's political football.
Right. Well, for you transgender, your transvestite, your cross-dressers, Monday morning comes around, they're back in their original role, going back to work. But this is who we are.
Right.
This isn't something that we do. This is just who we are. 24 hours a day from the day we were born.
Right. And what was really touching to me during the conference is at the end that the executive director of the Bronx Community Pride Center and also a board member got up, and when they were saying goodbye to everyone, they said the words transsexual, transgender, and intersex communities, and that really touched us so much because we think they understood. Diversity is a good thing. It should always be acknowledged. It should always be protected. The challenge with the word transgender is that it does not acknowledge diversity. It tries to make us all cookie-cutter versions of each other, and that's simply not the case. Having a medical condition is different than having a stage act. It's not a fetish. It should not be objectified. This is not an extension of the gay and lesbian movement. So we hope and pray that next, they're going to be having a citywide, hopefully they're going to be having a citywide healthcare conference next year. And our goal, we have a new working group that we started a while ago called TIGER. TIGER is an acronym for Transsexualism and Intersex Group for Education and Resistance. And this group is dedicated to maintaining the integrity and the accuracy of the transsexual medical condition with intersex people as well, and just to saying, look, hey, to the transgender ideology, social, political world, to just please be sensitive and please stop censoring our reality. What would you like? What would you like to say about having accurate representation in healthcare?
Well, we need that. There's confusion out there and a lot of disinformation. Like you said earlier, when people aren't sure, they put everything into one little box and it makes them feel more comfortable, but it's not right.
And it's hurting people with transsexualism. It's hurting us immensely.
Right. And the gay, lesbian, and for a large part, a lot of the transgender movement, theirs is more of a political agenda,
lifestyle,
political rights,
social,
and things like that, and those are valid points. But we're going down a different path.
For example, Nikki Aragus in Texas, she's the wife of the fallen firefighter. She's a woman who was born intersex, she had a transsexual medical condition. They are trying to say she's not a woman, and they're inaccurately calling her transgender, and she made a public statement saying, I'm not transgender. And now people are finally listening to her. But because of this miseducation, they're trying to deny her her benefits. Another example, recently this year in Maryland, there was an anti-discrimination bill for gender identity and gender expression. What ended up happening is that the far right and the bigots came in and said, we don't want cross-dressers and transvestite males in the restroom. And then we were like, excuse me, but people with transsexualism or people who are intersex are not transvestites or cross-dresser males. And then they were basically like, well, actually, according to GLAAD's media guide, under transgender it says cross-dresser, which could also mean transvestite, genderqueer, gender-varied, and transsexual. So until GLAAD and Gay Inc. and Transgender Inc. stop miseducating and misrepresenting transsexualism, it's amazing. They are teaching the same misgendering and marginalizing education that a lot of our detractors are. you know, I have nothing against drag queens. I had a drag queen perform at my birthday party once. I love them. But just because I say I'm not that doesn't mean I think I'm better than that. So, you know, it's just, you know, I'm just so happy that the city of Bronx and, you know, the city of New York did this Transgender Health Conference. Maybe next year we can call it the Transsexual and Transgender Health Conference. So, are you excited for next year's conference?
Oh, definitely.
Yes? Okay, we'll see you there.
Bye-bye.